Oncologist Dr. Sam Friedman has always been outspoken, but in recent weeks he's been more vocal, especially about what he believes has been going on at the Guam Memorial Hospital.
There's a lot of bad medicine going on there that's years out of date, and that would be very easy to bring up to standards.
Friedman, during a confirmation hearing before lawmakers on Friday, said patients are dying needlessly at the hospital. He specifically spoke of an incident that occurred 2 months ago when a 41-year-old woman was improperly treated during her pregnancy and as a result died while in labor at the hospital. The incident, the doctor says, is one of many that have been swept under the rug.
If no one's going to learn from mistakes, how do you expect to improve patient care? And the other part is the doctors, where the same thing happens. And if you're one of the boys, it gets buried. If you're not one of the boys, the most minutia, garbage gets dragged out for months. And Dr. Landstrom can speak to you about this. Get me a clearance from Mr. Vega or whoever it happens to be, and I will give you line and verse of the patients, what happened, who the doctor was, etc., etc. Then we'll see if I'm making things up.
It was really uncalled for. I think it was irresponsible, careless for him to say that doctors are killing patients.
Dr. Tom Shea has taken issue with Friedman's comments, so much so he wants the governor to withdraw the oncologist nomination to the GBME.
I think there's a good peer review process that's at the GMH that we follow. And majority of our doctors here are very compassionate and caring.
Dr. Shea believes Dr. Friedman's comments have created an unnecessary sense of panic within the community about the hospital and contends that changes and improvements are occurring at GMH.
I would certainly encourage Dr. Friedman to look on the happier side of life rather than focusing on such negativity for the community. That's not going to help. For somebody to want to sit on the board of medical examiner, he needs to rise above that. He needs to rise above the words he chooses to use and the attacks that he chooses to use.
Dr. Shea says the hospital may have settled a dozen cases in the last 5 years, but he contends medical malpractice and patients dying from complications is the norm at even the best medical facilities across the nation.
Patients die at other hospitals of complications, but not because the doctors are killing patients. There's a big difference between killing someone than somebody dying of complications. There's a big, big difference.
But despite the criticism from some of his colleagues, Dr. Friedman isn't backing down or apologizing for his statements, saying patient care at GMH must be improved. That's why he's hoping to sit on the Guam Board of Medical Examiners to help bring about the change that he contends is so desperately needed.
I could back up everything I've said and then some. If the people of Guam are satisfied with the medical care they get at the hospital, please let them continue to do so.